Hello, everyone. Happy 12 p.m. on Thursday. It is time for another round of the CL Derm Staying Beautiful webinar series. Today, we are very excited. We are going to be speaking about wrinkle smoothing and lip plumping with Dr. Monica Boen. She's an incredible board-certified dermatologist who's been with our practice for many years now. She actually started with her fellowship with Dr. Mitchell Goldman, so she learned all of her tricks from everyone else and has now, used them to really take it to the next level, and she's going to show you many photos of her results. I think there's still a couple of you joining today, and I know this is a topic of interest for a lot of people. So while we're waiting for everyone to join, at the bottom of your screen, there's a couple of buttons that you need to be aware of. One of them is the chat button, where you can talk to me or communicate if you have any questions. But if you have a question for Dr. Boen that you'd like answered during the Q&A portion, please put it under Q&A. So where that little box says Q&A, you guys can start putting in questions now. You can put them in as she is speaking, or you can do them at the end. But basically, Dr. Boen is going to present to everyone, and then at the end, we will open up and we will try and answer everyone's questions if we can. So let's see, it's 12:02. So I guess while we are letting a few last people join, I just want to do a little poll to ask a quick question to kind of see where we're all at. So there should be a little poll that pops up for you. Could you tell us, have you ever had a neuromodulator treatment? Neuromodulators, which you're about to learn a lot more about, are Botox, Dysport, Xeomin, or Jeuveau. So we would love to hear where you're at. Have you had them before? Are you good about always doing it every 3-4 months? You tried it once or twice? Are you interested, but you haven't tried, or you don't think it's for you? So another 10 seconds, and then at the end, just make sure you press submit so your answers get calculated. So everyone click submit. Okay. So let's share these results and see, for those of you that answered, now Dr. Boen can see them. So most of you are good, compliant Botox users, just like me. Well, before I couldn't get in because of COVID, but normally. Some of you have tried it a few times, a few of you are interested, and only one of you is a little bit scared. So that's good, and that helps give a little idea to Dr. Boen for where we're at today. So with this in mind, thank you all again for joining. For those of us that just came, this is our CL Derm webinar series on staying beautiful and healthy during our stay home mandate. We are here today with Dr. Monica Boen, and she is going to be speaking about wrinkle smoothers like Botox and lip plumpers. So with that, I will hand this off to Dr. Boen.
Hi, and welcome to our webinar series. Today we'll be talking about wrinkle smoothing and lip plumping. So a little background about me. I'm originally from Chicago, love the city. The food is amazing, the architecture is great, and go Cubs. So I went to Northwestern University for college and also went there for medical school. I did an internship by Boston at Cambridge Health Alliance, did my dermatology residency in Chicago as well, and then did an additional year of training in cosmetic dermatologic surgery in San Diego, California. And then I stayed on as an associate here, which I'm very thankful and very happy about. So why do we want smooth skin? Well, smooth skin is a sign of youth and health. It's a vital marker of our overall health and appearance. And with smooth skin, we have a friendlier impression. We look less angry, less tired. Without these 11 lines, we look a little bit friendlier and more helpful. And then finally, we want smooth skin so we can attract a more desirable mate. And then Desmond Morris said, flawless skin is the most universally desired human feature. And, I think I can agree with that. So what can we do to promote and maintain smooth skin? Well, first of all, we have to protect our skin from the elements. The most important is to protect our skin from ultraviolet radiation, which of course can cause skin cancers, especially in Southern California, where we're exposed to a lot of sun, but also from the daily pollution as well. And a good sunscreen with mineral base of SPF 30 or greater, and some have some boosters to help against pollution as well, and some infrared radiation, and they're available at our store at Cosmetic Laser Dermatology. You want to have a good topical skincare regimen, and this includes a good moisturizer to make sure the skin is hydrated. And of course, it'll depend on your skin type, which one we'd recommend. You want to have a good cleanser. Every day it's important to cleanse, and depending again on your skin type, we can recommend a few cleansers that would work for you. And then other boosters would be some growth factors, antioxidants, or retinols, retinoids to help with your skin health as well. And then one of the things we'll talk about today are neuromodulators, which are, it's also known brand name as Botox. We'll talk about the big four, and they're used to treat and also prevent wrinkles. So what causes wrinkles? So we have dozens of facial muscles that make our faces expressive. The problem is with repeated contractions of these muscles, we develop wrinkles. And so neuromodulators will relax the muscles so we don't form this expression. As you can see, I also have not had a treatment of a neuromodulator recently to prevent these lines. And then on the photos here, this patient had her frontalis or forehead muscle relax, and you can see now she raised her eyebrows just to form those lines, and so it is good to prevent and treat the active wrinkles that she has. And then we treated the orbicularis oculi, which is the muscle around the eye, and so now those crow's feet lines are relaxed. So let's talk about the science behind Botox. So botulinum toxin is produced by a bacteria called Clostridium botulinum. This paralyzes the muscle temporarily when very small purified doses are used. The diagram to the right shows a little bit about how this botulinum toxin interacts at the neuromuscular junction in order to relax the muscles. So this was actually used about 3 decades ago, so it's been around for a while. It was first used to treat blepharospasm, which is abnormal contractions of the eyelid muscles. So this is actually kind of a miracle for that treatment. And then they noticed that when you use it, your wrinkles and your skin were smoother, and this is kind of how this was transitioned into using it for cosmetic purposes. There are currently 4 neuromodulators on the market: Botox, Xeomin, Dysport, and Jeuveau. They differ in terms of their dosing and complexing proteins. And it's good to be familiar, make sure that your doctor is familiar with all 4. You do have to inject them a little bit differently, and their onset of action is a little different as well. And we have all currently available at our clinic. The duration is 3 to 4 months, but it's important to note that this is dose dependent. A higher dose will mean that this actually will last longer. And so it depends, and we can tailor it to, if you want just a little bit of muscle relaxation, we can do a lower dose, inject it a little differently, and you do not have to have the frozen look. Luckily, this has been around for a while, so we've refined our techniques to see what suits you the best. And also there's excellent safety data behind these agents. This says, I think, the Botox brand, this is their 30th anniversary. So it's been around for a while. Dozens of randomized clinical trials showing excellent safety data. So this is a patient who had a very strong glabellar complex, which are the 11 lines. And this means that she has very strong frown lines, and it can make you look a little bit angrier, maybe tired. So we relax this area with a neuromodulator. And as you can see, she cannot do that frowning expression anymore. And she is telling me that she looks less angry to her children. And then you can also do the same for the frontalis or forehead muscles. This is an example here. So neuromodulators are not only for the upper face, but can also be used for the lower face. The patient here on the top photos had a hyperdynamic muscle. She had a hyperdynamic mentalis muscle, and this is causing a pebbly chin. And when you place the neuromodulator selectively and correctly, you can then relax that chin muscle. And so you no longer have a pebbly appearance and it appears smoother. You can also do this for the platysmal bands or the vertical neck bands of the neck. And by relaxing this, you actually have a little bit of a neck lift because those muscles hold the lower face down. And by relaxing them, you can smoothen the skin of the neck. So we've talked a lot about how, Botox and these Jeuveau Dysport they work. When you target the muscle specifically, they are able to relax the muscles and they work. But what is the long-term effect of these neuromodulators? And this has been studied a lot as well. And I'd really like to take a look at this study. It was an identical twin study. So one twin had regular Botox injections over 13 years and the other did not. And you can kind of guess, I hope you can guess which one had it. So the one twin on the right had the regular Botox injections. And as you can see, she doesn't have these fine lines. She didn't develop as many of the 11 lines, the forehead lines, or the crow's feet lines. And from this and other studies, we have noticed that the long-term use of these neuromodulators can delay some of the signs of aging. Of course, you can't delay all of the signs of aging with just Botox. We lose bone, we lose subcutaneous fat pads, and skin elasticity. But at least in terms of the wrinkles due to muscle movement, they can be substantially delayed with neuromodulators, and then you might not have to do all these intense lasers or filler procedures in the future if you start earlier. And this is a patient in our clinic who had a year treatment neuromodulator, also had some treatment for rosacea. And as you can see, the skin is much smoother after consistent neuromodulator treatments, which started even after a year. And this is, we treated the frown lines and then the forehead lines here. And this is an example, this is a video you'll see of kind of how we perform the neuromodulators in clinic. So here we're injecting the frown lines using very tiny needles, which are very comfortable for patients. We apply a cold pack before, you can even have topical numbing. And now we're addressing a gummy smile, which is also a very sought after treatment. We're targeting specific lip elevator muscles. And then now this patient had very tiny crow's feet, so only did a little bit of a crow's feet, and now doing a little bit also of a brow lift. Great, and then there's many more videos about neuromodulator treatments and videos of what to expect on our website at clderm.com. Now on to lip plumping.
So I have my little poll that we can give real fast about lip plumping. So if you guys could give us some feedback again, have you ever had lip fillers before? So let us know, are you a regular lover of lip fillers? Yes, but maybe only once or a few times, like me before a wedding. No, but I want to, or no, I don't want to, I'm scared. So keep voting, please, and don't forget to click submit when you're done. We'll just do about 10 more seconds. I know it's only one question. All right, last chance to submit. All right, here we go. So it appears most of you, about half, have tried lip fillers but are not getting them regularly. And then a lot of you have not, but you're interested in trying. And then a lot of you that have not and kind of don't think you want to. So hopefully that helps Dr. Boen with the second part of her presentation. Oh, I wasn't sharing that. I'm sorry. There are the results.
Oh, great. Okay. we will address all of these concerns for you.
Great. Thank you.
So lip fillers arguably are one of the most desired and asked for cosmetic treatments out there. And I get asked for lip fillers of all ages, millennials to any age group. People are interested in lips now. Okay. So how did these lip fillers get so popular? And there's a lot of theories out there. Why are lips so popular? Healthy lips that have a well-defined border and proportional volume are a sign of health. And so that's another indicator of health. Is it due to the Kylie Jenner trend? I don't know, maybe, but we have seen an uptick in that after she came out and had lip fillers. Or is it a social media trend? I'm not sure, but whenever I do lip fillers on patients, they're very happy, has a high patient satisfaction, and that's why I love doing them. But most importantly, you have to know the lip anatomy. You have to know which lip fillers to use and which lip fillers are appropriate for each patient. And so for lip fillers, there are several anatomical considerations to take into account. First, there's a border of the lip, and that's called the vermilion border. You have the body of the lip called the vermilion zone. Then you have the corners of the mouth, which are called the oral commissures. And then lastly, you have the Cupid's bow, which is the apex of the lip and also helps give the lip its shape. And so you can volumize all of these areas, but they have to be done proportionally and with the right agents. And it's important to make sure that the lip is proportional to the rest of the face. You do not want to cause a bigger lip in a patient whose face cannot hold that lip. And this will vary based on different ethnicities, the ratios that are ideal. And lastly, youthful lips have a well-defined border, which can go away once we get wiser due to volume loss, and the volume should be medially and taper towards the corners. So the duck lip is something in the past, that is when you fill the entire lip without doing that volumized taper, which is so important. And now that we have studied this more and more, we can create a more natural looking lip. So this is an example of different techniques. So you can use a cannula versus needle. I do both. Sometimes I do it based on patient preference, and sometimes I do both depending on which areas need to be volumized. So the photo on the left is a standard needle, and on the right is a cannula. Cannula is a blunt tip tube that goes under the skin, and since it doesn't have a sharp point, it should cause less bruising and maybe a little safer. That is debatable. We debate that a lot in our dermatology conferences, but it usually depends on patient preference. I have noticed that there is less bruising with a cannula, and we've written a lot about this too, and maybe it's a little bit safer. There are fewer pokes of the cannula. Usually it's 1 or 2 entry points, and then you can revolumize the entire lip. And this is an example of the right patient before, and this is actually 2 days after the filler, so still a little swollen, but with cannula, we were able to have no bruising, and you can go to work right away. I will say the swelling of lip fillers depends on which lip filler to use. There's some lip fillers now out there, the newer ones have minimal swelling, so less apparent to friends and family or your husband if you want to do them. And others will have swelling for about 2 weeks. And we'll talk a little bit more about the duration of lip fillers. So the lip filler of choice that I always recommend are hyaluronic acid dermal fillers. Hyaluronic acid is a naturally occurring molecule in the skin, and it hydrates the skin. And I like to use this agent because it probably gives the most natural appearance. And also, luckily, it's not permanent and it can be reversed. So that is always good and increases the safety profile of these hyaluronic acid fillers. And so how long do these fillers last? So I always get this question because patients want the most long-lasting fillers. It can last up to 2 years, but on average, it's usually 6 to 12 months. And the reason is that we have to use softer fillers for the lips. And so these are less cross-linked, so they will not last as long. Also, this area moves a lot, and by moving, the body naturally resorbs some of this hyaluronic acid. And so we'll show some before and afters. So this is a classic kind of M-shaped lip. These are the lips that are actually very difficult to inject and have to be injected very carefully. And there's also a scar on this upper lip. So for this lip, we had to redefine the border and make the shape a little bit more symmetrical. And this was done with Juvederm Ultra with 1 syringe. And for this patient, only 1 syringe would be needed. And you can't plump these lips up too much, otherwise it'll be unproportional to the face, because these lips are not that wide. And if you add too much, or if the volume is disproportionate, it will look unnatural. And then a lot of patients already have great volume and a great shape to the lip, but they notice that when they smile, that the lip shape goes away, especially the top lip. And so the goal, we used Vobella here. The goal is in this patient was just to volumize a little bit, because she already had great lips to begin with, just so that when she would smile, that the upper lip would still show. And still we wanted to keep it very natural looking. However, some patients do ask me, they do want bigger lips. So we have to consider, can their face proportionally hold a bigger lip? In this patient, I think she was able to have a bigger lip, but this had to be done gradually. Whenever you do want to really volumize lips, they have to be done over a few months. You cannot just put 2 fillers in and then have a bigger lip. So this was done actually in the course of 6 to 8 months. So in this first photo here is the original lips. Here we added actually a full syringe of filler. So it plumped up a little bit. This was Vobella, so Vobella's a very light filler. It will not volumize that much. And then we added a few months later, Juvederm Ultra Plus, and this one volumized more, but she still wanted a little bit more, which I think the lips look great here, but I'm like, okay, the proportions are okay here. So we added another half syringe here. This was done over a few months because you want the tissue to expand slowly. Otherwise, it's going to cause too many problems, too much swelling. And this is how you get a larger lip volumization safely. And this is a video. This is using a needle technique, and I do both cannula and needle, and I'll play that for you here. So I've already volumized the other side, and this is the last area to be volumized. Sorry a little bit about the choppy video on the PowerPoint. And it's really important to inject very, very slowly for safety reasons. So they're very slow injections, and before this, the patient had topical numbing, so it was a very comfortable injection for her. And also the dermal fillers have lidocaine in them as well. So usually the first poke can be a little uncomfortable, but afterwards the dermal filler has lidocaine, so it's much more comfortable. And then another thing too, if you have a bruise, which is very common after your filler, we offer complimentary bruising treatments with a laser that will get rid of the bruise within 2 to 4 days. Otherwise, bruises can last from a week or 2 weeks. All right, well, thanks for listening. So in conclusion, neuromodulators are a great way to treat and prevent wrinkles. In addition to good skincare, maybe some laser treatments and sunscreen, of course. And then lip fillers are a great way to volumize and improve the appearance of the lips and have a very high patient satisfaction rate. And I'm wondering, you have about like 5 minutes for questions, and I really want to know if there's any other webinar topics you'd like to watch in the future. And for more information, my Instagram handle is California Derming. You can do a virtual consult at sealderm.com to give us a call. And we're closed now, but we'll be open whenever it's safe to continue.
Thank you so much, Dr. Boen. Okay, so if we have about 5 minutes for questions, we already have a number that are in here. If you guys want to keep popping in your questions, that would be great, and we'll get started right now. So here's Elaine. So she says, what can you do for a 64-year-old? I need the lip, under eye, forehead. What's the real outcome for older people, as all your models that you showed are very young?
Yes, and that's true. We have a little more photos of older patients too. And I think you can start neuromodulators in your 60s as well. It's hard though when the limbs are at rest. You might have to do other things such as lasers to help soften the lines, like microneedling radio frequency or a CO2 laser, depending on your skin type. And then for lips, we also, so usually for younger patients, I'll just do the body of the lip. But if you still have volume loss in this perioral area, we'll have to revolumize the perioral area as well with a few different fillers. And we can definitely also support the mid-face with fillers as well. Usually I'll support the mid-face before doing the tear troughs because it gives a little bit more natural appearance.
Great, thank you so much. So, okay, next question. What is the best product to inject to address lip wrinkles?
So a lot of times we have, because of the pursing motion, motion of the lip, there's a circular muscle around the lips, we get these little lines. And so probably you want a very soft filler if you're going to inject the lines, such as Bellatero, Restylane Refine, or Bovella. If you have too thick of a filler, you can actually see the product. So you have to be very specific with the product. And usually you want to combine it with a laser treatment too to help improve the appearance of those lines.
Okay, great. All right. Let's see. What is the best for under eye volume loss?
For under eye volume loss, so first we have to see, is it due to first is it a skin laxity issue? That's with the laser. If there's an infraorbital fat pad herniation in the lower eyelid, that would be probably a different procedure. But if it's just a tear trough under eye, we need some volume there. I would probably usually use a cannula because it's a very sensitive area under the eye. I would use a lighter filler, such as like a Restylane product or Bellatero, which is very, very light. Probably those are my two go-tos now because those don't swell as much. Some of the other, you have to be really careful under the eye. You can only do a little bit of filler at a time. You don't want that area to swell too much. That will cause other problems. Those are probably my go-to fillers for the under eye. And then it's really important for the under eye, you have to volumize that slowly. So no more than a syringe at a time. And then you have to wait a few months and then you can readdress. Maybe you can add a little bit more.
Okay, great. All right. Let's see a couple more questions here. So from Renee, what is the best to do with a heavily aged wrinkled neck?
For the neck, for the neck, if it's heavy wrinkle, probably the gold standard is a neck lift. But at our clinic, we try to do things that are minimally invasive. So for that, I'd probably see if we have a vertical band, so we can address that with some neuromodulator treatments and help lift the neck. You can do a Nefertiti lift. There's a few different ways that we can lift the neck with just Botox. To smoothen the skin, I'd probably do either a Fraxel laser or radio frequency microneedling. These are a series of treatments in order to improve the skin quality. And then lastly, we can do some skin boosting treatments with a little bit of a light dermal filler to revolumize the area. But for the neck, probably a combination approach would be best if we want to do the minimally invasive route.
Great, thank you. All right, so let's see, how much do the 4 neuromodulators cost and do they vary in price between them?
Yeah, so the 4 neuromodulators do vary in price because there are different companies that make them. Probably the most expensive one is probably the brand name Botox, and the other 3 are more similar costs. I think depending on where we're injecting, you can use any 4 of them. They're just different dosing. But yes, they're priced a little bit differently, just depending on how. So I think the Botox brand is the one that has been around the longest, so that one is the most expensive one.
Okay, great. And I'll just add to that, as Dr. Boen said, each one is from a different company. And because we order so much, because we are such a large injection clinic, and we are, one of the top injectors in the country, we actually a lot of times, almost every month, get some sort of promotion from them that we like to pass along to our patients. So if you're signed up for our email list, or if you're following us on social, or check out the promotion page on our website, we almost always have some sort of promotion going on with one of the 4 neuromodulators, which help make it a little bit more cost effective. All right, last question. I'm in my 20s and I feel like I'm already getting forehead wrinkles. Is it ever too early to start getting Botox to prevent them from deepening? And if I start early, will I have to keep getting them forever, or will my muscles kind of become retrained?
Yeah, so the wrinkles on the forehead are probably the first thing that you experience in your 20s, that and probably the crow's feet. And so it depends like on your skin type when the wrinkles form. You have a little bit more melanin pigment. Sometimes it forms a little bit later. But usually for patients in their 20s, I recommend like a very small dose just to prevent those wrinkles in the future. And for patients in their 20s, a lot of times they're just coming in twice a year, 2 to 3 times a year, and they will notice that they will need less and less for a period of time before later. But after years of doing Botox, there are studies showing that you do need less and less because the muscles are retrained. And then just another point, patients worry like what the long-term effect can the muscles always regain their strength? And so we've done like biopsies and studies showing that the muscles can regain their strength, and they're not permanently paralyzed after the neuromodulator treatments as well.
Great. All right, so one last question and then I promise we'll be finished. So I have thinning lips with aging. I'm 66 years old and I'd like to increase the volume, but I'm concerned with fake giant looking lips. What would you suggest?
Yeah, in that case, we can definitely keep it very natural. Usually patients in their 60s, we're improving a lot of times the border of the lip, and we're doing it with a soft filler. So it's not going to be dramatically revolumized. And usually we can even do like half a syringe, and a month later we go back and we do a little bit more. So I have noticed like after that initial treatment, patients then do come back, and they do come back every year, and they do want the whole syringe then. So it is possible. There's different techniques when you do more wiser lips, and then we take that into account so they don't look unnatural, and we will not give you a duck lip.
Okay, great. All right, everyone. Well, I'm glad we kept this short and concise, and I hope that you got a lot of interesting education and, useful information about all the different types of wrinkle smoothers and lip plumpers. If you have any further questions, there's a lot of information on our website, our social media handles. Dr. Boen is a great resource. Her Instagram profile should be on the screen for you right now. And she is also available, along with all of our physicians, for one-on-one video consults right now while we are unable to open. And we hope to be open soon. I think just today they said now it's looking more like June 1st might be the new date for California. I'm just seeing some news coming in, but we're playing it day by day. And as soon as we possibly can, we will be opening, probably with restricted hours and safer measures in place. So you can call and get yourself on the schedule. And otherwise, please, follow along with us on social, and we will be back for webinars next week. We have Lazanne, who is going to be speaking about vaginal rejuvenation, which is something that I know a lot of us are interested in hearing more about, but maybe you don't want to come in and talk about it or make a phone call. So this would be a great anonymous place to come and just hear kind of what it's all about, because our patients love it. It's really amazing. And then Farzaneh will be coming back to speak a little bit more about esthetician treatments. So you will also get a survey when we close this down. Any feedback you have, and like Dr. Boen said, any suggestions for future topics would be really helpful. I know we got a couple questions today about around the eye area, so I already wrote that down myself. But
awesome.
Otherwise, thank you so much, Dr. Boen.
Yeah, thank you so much for listening and joining in, and I hope you guys are all safe at home, and we're all in this together, and thank you again for joining our webinar.
Thank you so much. Bye, everyone.
Bye.